Now at 5:30, shining a spotlight on the COVID-19 racial divide.
A divide that's growing with this pandemic.
This crisis is magnifying cracks that have long existed in our healthcare system, and we ignore them now at our own risk.
We know COVID-19 doesn't discriminate. Anyone can get it, but we also know the virus is impacting people differently.
African Americans and Hispanics make up a higher percentage of the state's COVID-19 cases than their percentage of the population.
Health disparities and health inequities did not begin with this pandemic. We must look at ways that our current health system may be continuing to reproduce these inequalities.
State health data shows us that Black North Carolinians are more likely to have a chronic health condition that would put them at high risk for serious complications from COVID-19, and less likely than their white counterparts to have seen a doctor in the last 12 months.
But the disparity doesn't just appear in healthcare. The same story plays out in disproportionate access to wealth, food, housing, and education.
Not to mention the CDC says minority groups are overrepresented in jails and prisons where the virus can spread so quickly and with deadly results.
That's why right now at 5:30, we're laying out the problem and offering possible solutions to improve the health of our communities together. And good evening. Thanks for joining us for this special edition of Eyewitness News at 5:30. I'm Amber Rapinta.
And I'm Joel Brown. Tonight we are getting to the heart of the racial divide, that while this pandemic is impacting every one of us, it isn't impacting everyone equally.
We begin with Gloria Rodriguez tonight, showing us how inequities in our healthcare system are being magnified.
This is not the flu. This corona can and will kill you. Not a game.
Alfred Payne spent nearly a month in the hospital battling COVID-19, the coronavirus attacking his kidneys, causing him to catch pneumonia and to hallucinate.
You're waking up in a hospital alone, and that was the most horrific thing.
The Fayetteville resident is one of nearly 3,500 African Americans testing positive for COVID-19 in North Carolina.
We're predisposed for high blood pressure and heart disease, and that makes a huge difference with this virus, because the virus not only attacks the immune system, but it also attacks the cardiovascular system. And that's a huge difference and a huge player in why many of us are not surviving.
While African Americans account for 22% of our population, they account for 36% of COVID-19 cases and 35% of deaths.
These numbers are really upsetting and quite distressing, but they fall along the lines of what we know about health inequities in this state and in this country. We've seen inequalities by personal characteristics, by race and gender, by where we live in terms of rural versus urban geographies that play out in our health systems for as long as we've been collecting data on race or health in this country.
Dr. Giselle Corby-Smith heads up the UNC Center for Health Equity Research. She says minorities tend to have higher risk factors for poor outcomes in this pandemic, such as heart disease, diabetes, and high blood pressure. Her research finding:
minorities are more likely to be, quote unquote, those essential workers.
Payne owns a taxi and limo service. He thinks he got the coronavirus after driving a client.
I definitely had to work because that's my only way of making a living. There's nothing else for me really to depend on. If I don't transport clients, we don't eat.
Hispanics account for nearly 10% of North Carolina's population, but 23% of COVID-19 cases. Dr. Alexa Mieses-Malchuk is a family physician and assistant professor at UNC. She says our Latino population consists of a large number of recent immigrants who may not have the ability to work from home and face other challenges during this pandemic.
Not knowing how to navigate the system. Perhaps you speak a language different than English. Maybe you don't speak English at all. That can make it challenging to access health care.
Dr. Mieses-Malchuk says not having health insurance can be a barrier for some minorities.
What COVID is doing is putting a magnifying glass on health disparities. I'm hoping that we can come together as a society and really devise novel ways to make our healthcare system and our healthcare outcomes more equitable for our citizens.
As for Payne, he lost nearly 100 pounds while fighting the coronavirus and is now recovered. As North Carolina prepares to open back up, he has this message.
The social distancing is necessary. It's important. It makes it so that we all stay safe.
Moving forward, Dr. Corby Smith says we need accurate data on who is getting COVID-19 so we can really understand the scope of the problem. In Raleigh, Gloria Rodriguez, ABC 11 Eyewitness News.
And one more postscript to Gloria's story. About half of all North Carolinians are at higher risk for serious complications from COVID-19 because they're either over 65 or have at least one chronic health condition. And the racial divide is seen there too. State health data shows Black North Carolinians die of heart disease, stroke, cancer, diabetes, and kidney disease at a higher rate than white North Carolinians.
And of course, making ends meet is very tough for so many families right now, with more than 1 million people out of work in our state. Ahead here at 5:30, why this pandemic is hitting minority families even harder.
Right now in the racial divide, African Americans bearing the brunt of the COVID-19 financial impact. Workers of color have long been overrepresented in the nation's lowest paying jobs. And when economic downturns happen, those jobs are seen as the most expendable. It's a cycle that's played out many times over through the decades, and it's happening again.
My life right now is like I don't have a place to stay. I don't have a place to lay my head.
Marie Perry, 53 years old, born and raised in Raleigh with an 11th grade education, has survived more than most.
I was being burned with cigarettes, choked.
Last month, she escaped an abusive relationship and now scrambling to build a new life in an economy ravaged by the coronavirus. No car, couch surfing, relying on friends for a place to stay, taking home $115 a week from her job at a Garner donut shop.
It hurts. It's really hard to not know what you're gonna do. I feel unsafe. I'm not stable.
That instability made worse by the nation's wealth gap. Black Americans have the lowest median family wealth of any racial group, just over $17,400 a year. The median family wealth for white Americans, $171,000.
The pandemic is a reflection of the historical legacy of discrimination.
James Johnson studies race and economics at UNC's Keenan Flagler Business School. Over Skype, Johnson told us the nation's legacy of discrimination in housing and job hiring led to communities of concentrated poverty and large populations of working and jobless poor. COVID-19 now making all of it worse.
Let's talk about the fact that a lot of people of color, a lot of Black Americans have low-wage jobs, and that's a ripple effect on a family's ability to save money, to have something to pull on at a time like this.
That's exactly right. The one thing that most people may not realize is that we are disproportionately a population that lives in multi-generational households, a group of people who work every day, and some of them are very well educated, that don't make enough money to cover basic necessities given the living arrangements that they find themselves in the midst of.
It's just been tough and trying to get back on my feet.
At this budget Raleigh motel, 42-year-old Terry is 4 days behind on his bill after losing his job and apartment. He's been living in hotels since last August, now spending the pandemic looking for work and hoping for a lifeline, but says the health crisis has made getting help at the government or nonprofit level nearly impossible.
First started with social service. They just basically referred me back around to each other. First told to that they was only helping people with children. I don't have any kids. They told me then that they were only helping people that was 60 and older.
The system that is supposed to be put in place to help people, we got to do better.
Geraldine Olshami is an advocate for vulnerable people in marginalized Raleigh communities.
The people who are hardest hit are the people who are people of color.
She navigates the system for a living, but even she's struggling to get around the COVID-19 roadblocks to financial help for those who need it most.
There's just a constant turnover of loss of jobs, loss of homes. You know, that in itself brings about stress. So when we say that stress is one of the identifying factors that contribute to catching coronavirus, then these folks, they just don't have a chance.
Look at the top 2 industries in the nation's Job Quality Index. Over 10 million jobs in food and beverage services are vulnerable to layoffs during the pandemic. Over 6 million jobs in clothing and retail, 2 industries with a disproportionate amount of workers of color. And the jobs forecast from Professor Johnson was bleak.
I don't foresee a large number of those jobs coming back. And so we're on the cusp of additional vulnerabilities, additional stresses and strains.
And there have been complaints from African American business owners about not being able to get federal Paycheck Protection Program money. Round 2 of the program did include $60 billion specifically for minority and underserved borrowers.
To education, next up, schools go virtual, but a technological divide leaves some kids behind. How the abrupt shift to online learning is impacting communities across our state. Well, within the racial divide, we also find a significant digital divide. Distance learning is a challenge for families without resources like computers and high-speed internet. Tim Pulliam digging into the data, talking to families dealing with this firsthand, and showing us all how we can help.
Look at this county-by-county map of North Carolina. The darker the shade of blue, the deeper the digital divide.
There are definitely people out here hurting.
Letha Muhammad is a Southeast Raleigh mom of 3 tackling the divide through her group, Education Justice Alliance. During the COVID-19 pandemic, the group is working with Wake County Public Schools to help African American and Hispanic families obtain access to laptops and hotspots.
Talking to one parent who has 9 children and 5 of them are in the district, right? And the way she was overwhelmed, right? She hadn't gotten all the access to the digital stuff but was feeling pressure like her children needed to be able to engage, but she didn't have the resources to do.
In the state's largest school district, 3% of households don't have a computer. 13% don't have access to high-speed internet for digital streaming.
It will be challenging. It would be very challenging.
It's an issue our Joel Brown highlighted back in March, just before schools across the state closed. Shantae Hawkins, a single mother of 3, sharing a used computer that barely worked. After the story aired, a Raleigh biker group donated 2 laptops to the family. According to Pew Research, 86% of whites own a computer or laptop, compared to just 58% for blacks and 57% for Hispanics. School leaders say right now communities of color are struggling the most during COVID-19. But why?
I think the digital divide exists for the same reasons that we see divides in other aspects of life, whether we're talking about employment, healthcare, you name it.
Dr. Rodney Trice is Assistant Superintendent for Equity Affairs for Wake County Public Schools. Right now, he's working with a team thinking of ways to lessen the achievement gap during remote learning. Tutoring sessions with churches and civic groups is one strategy for next school year.
And it's unfortunate that when you have a pandemic such as this, and much of education is focused on remote learning and the use of those resources, communities of color will typically come up short because that's not where they focus their economic resources traditionally.
The digital divide in COVID-19 is also impacting higher education. Historically black colleges are now feeling the pressure to equip students with laptops and hotspots. Dr. Rachel Brooks is the coordinator for e-learning at NC Central. Surveys were used to determine which students needed help. Staff and liaisons collaborated with professors to transition coursework online. Even today, computers are still being shipped out to students returning this fall. Cy Young, a broadcast management professor at St. Augustine's University, describing to me his virtual experience with students.
But I have to assume that they're understanding. Still, the students that I have will let me know if they don't get it, and you know, usually they're kind, but sometimes, man, you confuse me.
For students who've yet to receive laptops and hotspots, St. Aug says professors call students on their phone with assignments. Some assignments are even submitted via text. Back in Letha Muhammad's home, her children are using remote learning across multiple laptops she already owns. She represents families of color on the other side of the spectrum, not as impacted by the racial digital divide.
Even if it isn't something I feel personally, I feel it because I'm connected to community, my community. As we move through this pandemic, there is an opportunity for us to examine why these things exist and then close these gaps.
Tim Pulliam, ABC 11 Eyewitness News.
And to get in touch with organizations providing support for families, you can head to abc11.com. Still ahead here tonight, what can we do now? We are providing solutions for how we can come together to improve outcomes in our communities.
So we spent the past half hour showing you the data, and we know it can feel overwhelming. We know it can feel bleak. So let's spend some time talking solutions, ways we can all make a difference to close the racial divide. Joanne Pierce joins us now. She's Durham County General Manager of Health and Wellbeing. And Joanne, we wanted to have you on because you spend a lot of time talking in this space, racial disparity and inequity. So first off, just interested in hearing your takeaways from the stories tonight.
Thank you. Certainly, it's not surprising that we see the racial inequities. Those who have been working to advance racial equity, we know without exception, across all of our systems, there are racial inequities, and the data always show us that. And so when we think about solutions or ways to address racial equity, we need to really first understand that there are no quick fixes. And why is that? Because just in our country, over generations, hundreds of years, inequities have been built into our systems and institutions through laws and policies, race-neutral policies. So it really will take careful consideration using a racial equity lens to address them.
And Joanne, these kinds of conversations can be awkward. They can be difficult to have when we're talking about outcomes in life that can be different based on race. No one wants to feel blamed. So how do we talk about it?
And that's a really important question. And it ties into what is our data telling us? That's one thing. And then we have to engage in courageous conversations about race, what it is, what it's not, how it operates, how it spins on its own axis, not requiring intent or permission. And so it really makes sense that we would have a different conversation. Otherwise, when we look at our data, not examining it, but looking at it and not sharing a narrative about how and why people are situated differently in society, we leave it to our imaginations about what's happening, often blaming people for poor outcomes and maybe even rewarding or complimenting people for the outcomes that they have in systems that are good. And so we have to really have those conversations if we want to change the trajectory of people's lives.
So COVID-19 is a worldwide emergency, and what typically happens after crises like this, whether it's a terror attack or a military action, there's an after-action report. What went right? What went wrong? If you're leading the COVID after-action team, how do you make sure we're having the right conversation?
Wow, that's a great question. And one of the first things we would need to do is really, I know that these groups are going to start forming, if they haven't already, these task forces, people coming together to gather best practices and also talk about, those lessons learned. But we need to have a deeper level conversation to ask, why did this happen? What are the lessons that we've learned from past disasters or issues that, affected people by race negatively?
Joanne, just a few seconds left. What do we do now? Is it new policies? Is it new laws?
Yes, we need to look at our policies and our practices. We need to see who's benefiting, who is not, by race and ethnicity. We have to really engage and have courageous conversations. We have to commit to advancing racial equity and be willing to learn and unlearn what we think we know so that we can really come to making decisions using a racial equity lens. And every decision that we make can be, a racial equity lens can be used.
Joanne Pierce is Durham County General Manager of Health and Wellbeing. Joanne, thanks for joining us.
Thank you.
And we thank you for joining us for this important conversation tonight. For more resources, you can head on over to abc11.com/coronavirus.